Welcome back, everyone. It is time for Medical Rounds, and we are working with doctors at Mercy Medical Center to bring you information about special treatment, surgery, and other hot medical topics of the day.
Well, tonight we focus on hernias. And with us now is Dr. Filipe Sobral. Dr. Sobral, thank you so much for joining us, general surgeon. We want to thank you for taking the time out to talk to us tonight. I mean, we talk about hernias, sometimes it's joked about a little bit. Oh, it's going to give me a hernia, but this is some very serious stuff. Are there different types of hernias?
Yes, there are. There are different types of hernias. Hernias can occur primarily. They are named after locations such as umbilical or inguinal or femoral, or they can happen after surgeries, and at which point they would be called incisional hernias.
Now, I've often heard that if you lift too much or overexert yourself, like you said, oh, I'm going to get a hernia. But is there anything you can do to prevent getting a hernia, different types of hernias?
Yeah, that's a very good question. Actually, it's a pretty complex topic, and debate is still ongoing regarding things such as the effect of physical activity on hernia formation. Basically, the typical patient would be someone who's an older gentleman and who has a connective tissue disorder or a very low BMI. But in general, hernias are thought to be caused by multifactorial issues such as genetic factors or lifestyle choices.
You know, you think of a hernia and you automatically think it's going to need surgery. Do all hernias need surgery, doctor?
Not necessarily, actually. Hernias that produce symptoms of pain or discomfort definitely need to be fixed. However, there are certain types of hernias that are minimally symptomatic or that don't produce any pain or discomfort that could be safely observed.
Now, if we do have to have hernia surgery, what is the average recovery time for that? Is there any physical therapy we have to go through to strengthen the muscles back up?
No physical therapy is required. The average recovery is highly patient dependent, of course. It depends on whether the hernia is repaired open or laparoscopically with minimally invasive techniques, smaller incisions, less pain. And there is even some evidence to support the notion that people could return to normal activity once they feel comfortable and would have no restrictions at that point.
That's good to hear.
There's so much more we could talk about.
Hernias run in my family, so I guess it's just a matter of time.
Notes.
I must be part of the genetic section of hernias.
Definitely.
All right, doctor.
Dr. Filipe Sobral, thank you so much for taking the time out to join us tonight with some very important information.
Very welcome. Thank you.
And there will be a free hernia screening event, coincidentally, Tuesday.
I'm paying attention to this as well.
Yes, write this down.
Indeed.
November 19th, 175 Carew Street, Suite 110. That's on the Mercy Medical Center campus in Springfield. 5:30 in the evening is registration. Refreshments are also being served. That's at 6. Information session and screening to follow. So some great information there. And hey, why not take advantage?